This is the Professional Hypnotherapist podcast, a production of the European Association of Professional Hypnotherapists. That's EAPH.ie.
From working with clients who present with anxiety to other forms of anxiety to children who self-harm, this podcast is jam-packed full of valuable information that empowers you to take the right steps leading to a positive, beneficial outcome for you or your loved one. All on today's Professional Hypnotherapist podcast. And once again, I want to welcome back to our podcast Susan McElligott from Cork. And Susan has a very special message for us today in this podcast, because Susan is going to tell us about how she works with clients who may be apprehensive about consulting with a hypnotherapist, who may have a little bit of nervous or anxiety about consulting with a hypnotherapist. So Susan, very welcome back to our podcast.
Thank you, Aidan, and it's a pleasure to be here again.
Great. Now, Susan, so let's start off, Susan. What do you do with a client or somebody who rings you up and says, "Look, I'm having this difficulty, anxiety or stress or whatever it is"? What's your approach? Maybe you'd outline that so that our listeners, members of the public, will get some benefit out of this podcast today.
Yes, Aidan, I know when people phone me up anyway, I have the advantage of hearing their voice. So I know straight away with the tone in their voice, it's very easy to tell somebody's nervous, they're not sure what to expect. They sometimes ask me for a technique, or do you do CBT, do you do counselling? But at the end of the day, they don't know really what they want. They know what they don't want, which is their anxiety. But they're kind of, fumbling around in the dark, if you like, and it's a minefield out there with all the different types of therapy that's on offer for people. So I hear it in their voice, and I try to put them, their mind at ease, and I explain a little bit about what I can offer them. And then as I'm explaining, they say, "Oh, that's exactly what it is," or I try to let the client see that I get it, where they're coming from. Obviously, I don't know, I don't experience what they're experiencing, but I have an idea, how I could help them, I suppose. Mm-hmm. So, yes, I put their mind at ease. I'd explain what they can expect when they come to see me in person in my office. And for those people that are not sure about coming to a therapist and, offloading or, revealing, I suppose, their vulnerabilities, and they're not sure. So yes, I'm very mindful of that. And I do offer online therapy for those people that would prefer to do it, virtually, I suppose. So video therapy is another way that I can do this type of work. So if those people are interested, but
yeah.
So were you going to say something there?
Yeah, in terms of, what should a client expect when they consult with a hypnotherapist? I mean, you mentioned there, you meet them and you greet them, and I suppose, is it a case of, meeting clients where they're at and perhaps taking them, helping them to go, or bringing them along as to where they want to be? So that, is it important, Susan, that a client would have in their mind what it is exactly they want to achieve in terms of their outcome, the therapeutic outcome? Is that important or not?
Not really, Aidan. Most people that come to me, most of them know what they don't want. They're very, very good at telling me all the things that they don't want in their life. Anxiety or depression, or they don't want to be on medication, or, and they just say, "Oh, I just want to be happy," or "I just want to be relaxed." And I might say, "What does that mean for you?" Yeah. And they still can't answer, what does it mean to be happy? So that's my job, is to maybe bring them to that place of awareness where they do know what happiness looks like or feels like, if you like.
Yeah. So,
but yes.
Is it a case of, when they say, well, they know what they don't want. But of course, we all know that, in order for you to think about what you don't want to think about, you have to think about it first before you don't think about it.
That's that is true, yes.
So
yes.
It's really important in terms of how we talk to ourselves, isn't it? That the language that we use.
Yes, and I think we're hardwired to expect the worst, or the brain is always trying to protect us, and we're always looking at what could go wrong, and it's about, avoiding danger, I suppose, and, how can we kind of get out of the situation we're in, and people don't have the tools or the skills to get themselves out of it. And this is why they consult. You mentioned earlier their hypnotherapy in particular, and that's why we're talking about this, is how hypnotherapy differs even from counselling and psychotherapy. Now, I use both in my practice as a hypnotherapist. I use psychotherapy, and there's hundreds and hundreds of different types of psychotherapy out there. But hypnotherapy in particular is all about targeting the emotional brain. That's where that's where the problem lies, in the emotional part of the brain. And using a cognitive approach, like CBT, for instance, which I do, on its own isn't enough, in my opinion. Cognitive therapy is all about the talking and rationalizing and the logic and what I should be doing different. And that works to a point. But when there's emotion, turbulent emotion going on, as in panic attacks, that's quite a heightened state, or any phobias, that would be quite a heightened state as well. Yeah. Then this is where hypnotherapy shines. And it's very easy for a hypnotherapist, if they're properly trained, to take the client through this process where they can identify that energy. And I speak about energy as in all emotion is energy in motion. Yeah. And when they can feel the emotion, and very often I'd say, where in your body will you feel the emotion? I had a gentleman recently who described his hands shake, or his heart starts beating fast, or he feels he can't breathe. So in that case, his body is able to communicate what he's feeling, but yet his cognitive brain is trying to make sense of it, and he can't. And I might say, well, what's happening? I don't know. I think I'm getting a heart attack. Yeah. And it might take him to the A&E, and might take him to have heart monitors monitoring his heart. And most of my clients come back to me after being to the A&E, or to gone down the route of having many medical tests, to come out with this, idea that there's nothing physically wrong with me, but it feels like it's something physical. So I specialize in trauma and helping the person who is having one of these. It's almost like having an existential crisis, where they think the whole world is falling apart, and they're drowning in their emotion.
Yes. So what I'm getting. Sorry, what I'm getting from you, Susan, I beg your pardon, is that the conscious mind, the mind that you and I are talking in now, or that mind that gives verbal responses. Oftentimes, I think the conscious mind thinks. What I'm getting from it, thinks that if it knows the solution to a problem logically, it won't have that problem. Is that the case?
No, that's not the case. It would be the ideal world if we could write down what are disempowering thoughts. Column 1. Column 2 is, how is this affecting me? So it could be, I'm suffering with depression. Column 3, what could I do instead? And column 4 is, how am I going to feel now if I can implement these new beliefs or new thought process.
Yeah.
And that's in the ideal world, and that looks all great on paper. But try putting it into practice when you're being triggered by an external stimuli. If, for instance, in the workplace, if you're working with somebody like a boss who is very controlling or domineering or patronizing, and there the triggers are again. And that trigger, often I find that, especially when I'm doing some hypnotherapy, I could get the client to regress back to maybe age 5 or maybe age 10, and it could be a father figure that, their boss reminds them of, that used to shout at them. And they think, oh, maybe because they're 30 or 40 years old now and they're in a senior position leading a team in the corporate world, maybe, that they feel that that's ridiculous. So that happened when I was 5. But the mind doesn't forget, and the unconscious mind or subconscious mind has no idea how old you are.
Yeah.
It thinks you're 5 again when your boss is shouting at you.
Yeah. So
what I call that is a bad trance. When you're in a bad trance, then my job is to get the client to wake up and to become aware, cognitively aware as well, but also, and I talk differently as well. I talk about energy. The client can tell me their story, and you can get stuck in the story. And you can go round and round and round talking about what happened to you. But as one famous doctor says, Gabor Mate, who specializes in, he's a Canadian doctor, he specializes in trauma and addictions. And he said, it's not what happened to you, it's what happens inside of you as a result of what happened to you, which I think is fascinating.
So in other words,
it's all about perception.
Yeah, and it's the brain's way, or the unconscious mind's way of interpreting what happened to you. Is that correct?
That is correct. And how we interpret all depends on what our programs are. When I speak about our programs, I mean that when we come into this world, we have the clean slate, and then whatever we learn, I know some of it can be hereditary, certain traits, but if you're living with, say, a mother or a father, who's depressed, you can, it depends what you were subjected to as a child growing up. You can witness your caregiver being depressed, and you can take on some of those traits. Now, that's not to say it's written in stone, that that's the way you're going to be for the rest of your life. When people come to me, they come to me because they're sick of it. They want to change. They don't want to be depressed like their mother or their father. So they want a better life maybe, or they don't want to pass on to their children, because patterns can be passed down through generations, as you know, Aidan.
Yeah. So you said they want a better life, and they don't want this, but my question is, what do they want in terms of how will they know that they have achieved something without necessarily having maybe a visualization of it, or perhaps a feeling or an awareness, or am I talking nonsense here, Susan, or maybe you correct me?
How will they know?
Yeah.
So sometimes what's very interesting is what I find a lot in my work is that when the person is telling me their story, and it sounds like we're just chatting, but they're talking about, they went skiing, or they went swimming, or went fishing with their father, or they went camping, and they just kind of sweep it by the wayside, like that was in the past. But I might say, well, can you remember what that felt like when you went camping? Or when you went fishing, what was that like for you? They then have to go back and elicit that memory. And as I said to you before, the subconscious mind has no idea how old you are. So if I have a 40-year-old in front of me who remembers going fishing at age 9 and thought it was the most peaceful thing or the most exciting thing, then what I do under hypnosis, I facilitate that the client going back in time to re-experience that positive emotion. And I call that their strength. So I use that then later on in the session in the form of a parts therapy. Parts therapy is, you can have 10, 15 parts. I don't always work with all of them. I might only need maybe 2 or 3 parts, depending on the presenting problem. But if the part of them that went fishing at age 9 felt happy, then I would kind of regress them back. So how I do that is I use a technique. It's actually Gestalt Therapy, and it's all about unfinished business. So I use what we call in the hypnotherapy world the bridge effect. So I get them to imagine they're in a nice meadow, and you look ahead and you see a bridge. And now your adult self is going to walk towards the bridge, go over the bridge. Now, I'm doing this really slowly, and I'm incorporating all the sounds, if it's birds chirping, or the smell of the flowers, or the cut grass. So I'm engaging using Neuro-Linguistics, NLP, all the senses. So the sound, the smell, and that creates a nice medium trance where the unconscious mind thinks that they're actually there. And most people have that memory of cut grass anyway, or a smell of a flower, or see the blue sky. And then they go back over the bridge, going back in time, as I'm giving suggestions that they're going deeper and deeper, more and more relaxed, and going back then to visit their 9-year-old self, we'll say. Just an example. They're fishing and they're back there again and bringing up the emotions. And then I anchor them then to that positive emotion. So what you said there earlier was, how do they know?
Yeah, how do
so
they
I'm
know?
Using the inner world, or like it's an inside job, I often say to the client, instead of looking externally for happiness, find, even if you were only baking cakes in cookery class when you were 10, anything, if you felt proud of it. So it's not the actual event I'm more interested in, it's the actual emotion that event brings up within them. And they can attach themselves that and feel proud of themselves. So this is a whole process that I do. So all the parts then can work together. So if they come to me and say one of them was loneliness maybe, or I feel ostracized at work, or I feel rejected or something like that. So then my job then is to go and find the part within them that would match that, to say almost like a collaborative approach of all your parts. But I always do this as an internal resource for the client. So they feel it's not the therapist fixing them. Because some people say, could you just fix me? And a lot of people have this illusion that a hypnotherapist has the magic wand. And, I often joke there, Aidan, I say, I have a new supply coming in next week. I'm all out of magic wands, this week.
So,
but for now, we just...
it's very interesting that, you say that we have the resources within ourselves. And so you go back to an earlier time in that person's life, and you discover, that the positivity of it, the good feelings, etc., etc. And so, okay, that was back then. But then the client, that person gets older, and we'll say something happens them. They some emotional, again, it's probably emotionally charged events. And it seems that from listening to you, that these emotionally charged later events in this person's life overshadows what happened before. The good feelings or the good times. And it seems as though that, the mind spreads like butter all over their whole awareness, their whole life. This emotionally charged event has this negative effect on the client. And you're saying that you can go right back to that earlier time, which was the positive time, and will have a positive, so almost like a collapsing on the subsequent negative event. Am I making sense here, Susan?
Yes, you are. But, I don't want to oversimplify it either, Aidan, because, bad things do happen to good people. And we lose loved ones. We are bereaved. We're traumatized. We're, overpowered with grief. And we have, as I said earlier, an existential crisis. Now, in that particular situation, it's not a kind of a case of going back and finding that happy place. What I try to do, depending again on the age of the client, I do work with children as well, and I'll come to that there in a minute. But going back to what you said, if I'm dealing with a grown adult who's had, experienced tragic circumstances, I will hold the space for them, and I'll say, you never get over this loss. But you'll get through it. You will get through it. You won't get over it. And you can move on. You can do both. So it's not about, just move on and, forget about it. It's about recognizing that you are resourceful, recognizing that you do have resilience. And then it's my job then to find areas in their lives where they have been resilient. But never to negate somebody's experience, never to undermine it either. Okay. My therapy is very solution-focused hypnosis. And it's all about, honouring the person for the trauma that they've been through, but it doesn't define them. They are not the trauma. They're not what happened to them. And I deal a lot with bereaved clients who've lost loved ones. I had a lady recently who, it was the first anniversary of her aunt, and she could not stop crying thinking of the day the aunt died. And she said, how am I going to get through this? My mum is coming, my sister's coming, my husband, we're all going to be there together to listen to the mass and online. How am I going to do it? I said, tell me more about your aunt. Tell me about her. She loved, the colour red. She loved, so I said, wear red when you're honouring your aunt. And she said, I never thought of that. And I said, I want you to think of her now and connect to her energy. What was she like? And she started laughing. Straight away she was laughing because she was back in trance. Yeah. Back to the times, how long, I don't know, 35 years she knew her aunt. Think of 35 years of all the great times you've had with her and honour her, make her life matter. And she thought, I never thought of it that way. So it's about, I suppose, training your brain to look at what's right. What can I do rather than what can't I do? Yeah. Or getting stuck in a negative trance.
It's important in terms of what I'm hearing is that, the perspective that you have or the filters that you put on life in terms of, you often hear the expression, your rose-tinted glasses. And then, it's how we view what is happening to us as well that has an effect on how we feel about something. Would I be right in saying that?
Yes, 100%. I did that because my own mother passed in 2014, and I choose, and I always emphasize the word choice. I choose to remember all the positives, what I've learned from the time I knew her, as long as she's been in my life as a mother. And not saying it was all roses in the garden, but it's my choice what filters I use. What you said there about filters is exactly what it is about. It's how you choose. And therein lies your freedom.
Indeed. And
choose.
Absolutely. And what I'm getting as well, Susan, is that what I'm hearing is, to choose or to have the capacity or the ability to choose is so empowering. Whereas, other than choosing is somewhat debilitating and it usurps all the power that we have. But when you choose, you have that, my mind is saying, you have that determination, you have that power to to actually lay out a chart, a road for you that you want.
Yes, that is true. And there are going to be days when you're feeling down, and of course you're going to miss your loved one and wish you could just pick up the phone. And, I have a few videos that I have of my mother. Actually, funny enough, we talk about this now because it was only last night. I had another look, and I was laughing so much, and I was becoming the observer of my own reaction. Which I don't know if you know what I'm talking about here, but it's like the watchman at the gate of your thoughts. I was noticing myself all these years on, laughing at the fun that we had. And it was a video of the two of us singing. And just to look at my mother laughing, and I was making her laugh. And I'm holding on to those precious moments because it's like I feed off this. You can feed your mind with the positive, good stuff, the happy times, or you can choose to go down that, and I do go to that place that, gosh, I wish I could just pick up the phone now and hear her voice.
Yeah.
Not to say I'm sweeping it away and forgetting about it. It's about being real, and it's about being human, I suppose, too.
Indeed. Yeah. And when we talk about our mind, and we use the terms, conscious mind, unconscious or subconscious mind, and we know that these are just metaphors to enable us to speak about such a powerful organ that we have within ourselves.
Yes, you spoke about metaphors as well. Metaphors are just a very indirect way of getting to the subconscious, because the subconscious, it's interesting now that the subconscious will actually get us to do things like that might not be in our best interest, in the kind of pretense that it's doing us a favor. I mean, how many people would continue smoking if, logically they know it's bad for them, or overeating or drinking too much? They know it's bad for them, but their subconscious mind thinks that, oh, well, if you smoke, you're going to be more relaxed, or you need it, or you deserve it. You've been working hard all day, you deserve a fag. So that's the tricky part. And this is why metaphor is so powerful, that it's the language of the subconscious mind. So you're not using a direct approach, and you're not telling the client you should give up smoking. You're using a very gentle, soft, indirect approach to get them to imagine themselves as a non-smoker. Some people can't imagine themselves ever achieving it. So that's my job, is to help them to develop that new persona. Maybe they've never known it, because they might have started smoking at age 10 maybe, or 12, and they can never see themselves as anything other than a smoker. So this is why hypnotherapy is so powerful. But the use of metaphor, I don't know if they use it in other therapies, talking therapies, but this is why hypnosis and hypnotherapy, I think, is definitely, maybe I'm biased, but I think it's a much faster solution than doing, months and months or years of therapy, which I often come across clients that come to me say they've been years dealing with certain issues, and then halfway through the first session I might say something or suggest something, and then they start crying, and I thought I dealt with that. And it might have just been a talking therapy. But I work also with children, Aidan. Had I mentioned that earlier to you? Children are fantastic for using the imagination. Our work is a lot easier, I think, working with them. But I deal a lot with children who, who are having panic attacks, nightmares, and, some of them can't communicate with parents. They're bottling it up. And unfortunately, I've had quite a few recently who are self-harming at a very young age, who have suicidal ideation, young age, as young as 8, 10, 12.
Wow.
And the parents are literally at the end of their tether. They don't know what to do. They don't know where to turn. And what I generally do is I insist that the parent come and sit in the room with their child. And
Yeah.
some parents think they're dropping their child off to me, and they'll collect them later. And I say, no, you can sit with
And you
your...
go and fix them. Yeah.
Oh, yes. Yeah, let me know when you're done. No, I'd say come and sit. And then I always check. First of all, I'm watching body language. I'm watching all the micro expressions as we do, because the body speaks. And I see the parent's reaction to the child. Sometimes they're horrified. Their jaw is dropping open because it's like they've met their child for the first time. The communication it's like they're not communicating. The child usually feels they're not heard. Then the parent might insist, I'm listening to my child. Doesn't mean that they hear the child though, or understand the child. So my job again is to get that kind of mutual communication going between the parent and the child. And it's usually a very, very positive outcome. As I've said before, Aidan, there's no blame games when it comes to parents, because I'm a parent myself. And it's always
And when it comes to, children, and, you mentioned that the parent is there, it's so important that people out there would know that, safeguarding is so important, particularly in any aspect of life, but more so indeed in a therapeutic environment whereby, we, as reputable, ethical, professional hypnotherapists, safeguarding is so important, and we abide and adhere by all the rules and regulations. So it is important that a parent be present. Isn't that correct?
100%. And I often have I'd say if the mother is there, for instance, and there's an issue with dad, maybe dad has anger issues or snapping in the household, I'd say, I need to see dad next week. I need to see maybe all three of them in the room, or maybe the child with the dad, to see the different dynamics that's going on. But again, I have to emphasize, it's always a very positive outcome. It's always finding the solution of what works. And we make...
Have you ever come across, a parent or parents who say, well, you're not going to hypnotize my child, and that emanates from a total misunderstanding of the work that hypnotherapy, ethical, reputable, professional hypnotherapists do. Could you comment on that for me?
I think it's all in the preparation, and as a hypnotherapist, I think it's our duty to inform a client before they even step into your office exactly what to expect and what not to expect. This is important, so there's no surprises. That hypnosis is a natural phenomena which we drift in and out of all day long. Our brains can't function otherwise it gets overloaded. Our conscious brain can only take care of about 4 or 5 things at any one time. Most of our activities and our behaviors are unconscious. This is where, we're operating from most of the time. So I explain it, and I take away that kind of stigma that's attached to it. And what I'm finding as well, because I work a lot with children, all age groups, from as young as 4, the parents always say to me, gosh, I nearly fell asleep myself, or gosh, I was hypnotized myself. So it's like 2 for the price of 1 in the room. They see what I do.
And of course, just to make a comment that you mentioned there's sleep. Hypnosis is not sleep.
We call it a hypnotic trance, or a trance-like state. No, it's not. It's not the sleep of bedtime. No. So if you think about when you put your head on the pillow, you never really quite remember the exact time you fell asleep. Or when you're coming to in the morning, it's that in-between stage from being fast asleep to being fully wide awake. That kind of nice...
Would it be true to say that it's almost like a sleep of the nervous system? Would that be an expression that could be used, do you think?
It could be used. I often refer to the sympathetic nervous system, that fight or flight response, that high alert response, which can be quite exhausting. And without getting too technical here, Aidan, but it's about engaging the parasympathetic nervous system, that, we call it vagal braking, the vagal nerve, and it's about calming ourselves right down. And I like to teach my clients all about vagal braking, all about how to, in the moment, how to calm themselves right down. So my therapy is very much skills training as well. I like the client to leave my office, even on the first session, with a how-to.
Yeah.
If this happens again, what am I going to do?
That's really important.
If it's a panic attack.
I think that's really important that, from the very early stages of therapy with a reputable hypnotherapist, that you are, you are empowering the client. You're passing on to them, imparting to them knowledge, useful techniques, not fly up in the sky stuff. This is practical stuff, practical strategies that you can employ immediately.
100%. That's exactly what it is. I often say, because people, they query, oh, well, how long is it going to take? How many sessions? I can't tell anybody how many sessions it's going to take. But what I do say is that if you're going for your driving lessons, you learn how to drive the car, but then you need to practice in between the lessons, because it's all new behavior. And now you can get in a car, if you're a seasoned driver like I am, you can get in a car and you can think of 101 things going through your mind. And I have a manual car. I don't have to stop and think, where's first gear, where's second gear? Do I need to check my mirror? Do I need to look over my shoulder? My subconscious mind does all that for me. So this is about retraining the brain. And again, without getting too technical, but anyway, I'll throw the word in, is neuroplasticity. Yeah. It's all about learning new behaviors and creating those new neural pathways in the brain. And when we get used to it, then it will become a new person, literally. Yeah. So another thing I forgot to mention there, Aidan, is that I make MP3 recordings, especially for children. And I think parents like this idea. If I'm dealing with a young child who has nightmares or anxiety, I will make a little recording live and email it to the parent. So they can put on headphones and the child can go to sleep listening to this hypnotic recording with suggestions of, and it's totally personalized for the child. So I had one little boy actually who needed to be on his own for 20 minutes before his mother came home from work. So he had his key and he'd opened the front door, but he had terrible panic attacks that robbers were going to come and attack him. But he had a little dog. His little dog would be there. So there was no way that he got comfort. No matter how much the mother said, your dog will protect you and bark if a robber comes, he still wouldn't believe the mother. He still couldn't get rid of the panic attacks and the fears. It was quite a heightened state of anxiety. So the mum said, can you help him? Yeah. Just for 20 minutes until I get home. So what I did is I reframed the whole thing. I got him to connect to the energy of the dog, who he loved. And I got him to change his perception of himself. Instead of being the vulnerable person waiting for his mum to get home and afraid of robbers, I got him to say, you know what, your little dog is delighted to see you coming and you're going to give him a treat for being so good for guarding the house and you're going to give him some food and you're going to... And I gave him responsibility. And he started looking at himself in a different way then.
That's important.
And it worked. It worked for him because of the feedback I got from the mother. Said he's a totally different child.
And in your opinion, Susan, what in your opinion is the greatest cause of anxiety or stress for children? If there is such a thing, I'd be grateful if you would impart that to us.
The greatest cause of anxiety in amongst children, I think they have questions and they're not being answered. You know, they have fears and they get it into their head that this is going to happen or that's going to happen, or maybe in the case where the parents are, going through some marital difficulties, maybe it's their fault. And this is all their own perception, their own way of looking at things. Sometimes it's parents are trying to protect their children. We won't tell them yet in case it upset them. And children are not stupid. They can pick up, they can sense it, and this can cause anxiety. It's lack of information. It's the fear of the unknown.
I think that's really important, Susan, in terms of, you mentioned that they have questions, that they need to know the answers. And they don't need to know the full details, but they need to, in other words, be respected. I think that's important, to respect, the child's need to have an understanding. Am I right in saying that?
Yes, the child, the need for understanding, that's very important, but they need to know that somebody gets them. I know I had a child in front of me, and she was saying nothing. She was literally sitting there almost mute, and the mother was quite anxious for her to get some help. But I think she was bullied by a teacher, as far as I remember. But that's what it was. And I asked the mother, did the child get an apology? And she said, well, the teacher apologized to me. But I said, it's your daughter that is upset. Why would the teacher just apologize to you? Did she apologize to your daughter? And the daughter sat up in her chair, looked into my face with delight. I could see that she was thinking, somebody's listening to me. And I did make it clear to the mother, it's the daughter that needs the apology. And I would insist on that. So just to be heard, that's like the common denominator, Aidan. What I'm hearing a lot is that, I'm not saying that the parents aren't well-meaning. It's sometimes the parents themselves don't have the skills.
And
they think they're doing the right thing.
And it's that unheard child, who grows up to be an unheard adult and maybe an anxious adult. Would you comment on that?
This is it, and this is what I said about patterns of behaviour, and sometimes they can get so despondent, disillusioned with what's the point, and they can become quiet, they can become introverted, when that's not their natural tendency, or they just shut up and say nothing because there's no point, I'm not going to be heard anyway. And that can develop into a character trait. And then they become resentful. They don't like who they are. It sort of taints their whole view of themselves. It changes who they are, which is unfortunate.
And, just to go back to what we started out almost at the beginning in terms of the person who has anxiety or stress, or they may have what we may refer to as that something inside of us that we really can't put a finger on. And maybe it's just a generalized anxiety, something like that. In terms of how do you greet someone like that, just to recap, or how do you, approach or meet a person who presents themselves with this sort of, I know there's something that's not right within me, and I just can't put my finger on it.
Mm-hmm. So you're asking me, how do I?
How would you greet, or how would you meet somebody in the therapeutic environment about that? If that makes sense. I usually know.
See, it does make sense, Ian. What I do, and again, I'm using a kind of a covert way, like it's called conversational hypnosis or Ericksonian hypnosis, based on the work of Milton Erickson, the famous psychiatrist. He did a very covert approach, and that's what I do. And when people come in and I'm chatting, I'm not just chatting. I'm watching their body language and how they express themselves, what words they're using. That's all like your how you process your thoughts. Using language patterns, and I can tell an awful lot. And I might have a client saying, oh, well, we're getting a bit off topic now. She might be talking about one of her daughters or her dog or something, but it's never off topic, never. Because at the end, when I'm doing the hypnosis session, I always include the daughter or your dog, and then they laugh when they open their eyes. Now I know why you were talking about this and that. So it's a very much a holistic approach as well, Aidan, that I use. Going back to what you said there, it would be body language, it would be the tone of voice. So how we communicate is, body language is huge. People use their hands, eye movement, downturn of the mouth. You can tell, but you have to be fairly alert to see these. We're trained as hypnotherapists, I think, to read people. And so words are only 7%. What people actually say. I'm not just listening to their words. I'm listening to the energy behind it, the emotion behind their words.
And what little bit of advice, or maybe a short technique right now to somebody who's listening, and they may have a little anxiety, or they may have a fear of something, or maybe they find themselves, wanting to stay inside a lot more, rather because of COVID. It has caused a lot of people to become, housebound. What little bit of advice, or is there any little bit of technique you could impart right now to them?
Well, what I always think, especially during COVID and lockdown, is get out of the bed and make your bed. There's actually a therapist out there, I don't know who it is, but I remember hearing it. Get up and make your bed if you feel depressed. That's stage one. Just do it in little increments, little baby steps, nothing major. Go in and brush your teeth. Go in and wash your face. Comb your hair. Put on something nice so that you're as though you're going to work. Something you're not, kind of hanging around the house in your pajamas, so that you feel, even if you've nowhere to go, just, so that your environment that you're looking at, even if it's only a one-room apartment, that things are tidy around you. Once you think in order, things that you can control, like just making the bed or tidying up, gives you that kind of illusion, I suppose, of control. There are lots of other things as well. Again, grounding yourself, if you have a back garden, walk barefoot, connect to the earth, which is good for grounding you.
You mentioned also, Susan, earlier with regard to that you record MP3s for clients. Is that something that a client or a prospective client could call you up and say, well, look, I'd like maybe a little bit of recording of relaxation. Could you do that for them?
I don't particularly do a generic one. I usually do it when they're in front of me, because I have to get to know the person. They can get them off the internet if it's just a general relaxation hypnotherapy. I do have one which I do send after I've met the client. Or if somebody was in a bad way, for instance, and they rang me up and they couldn't come and see me, and I wouldn't mind sending them a link to it on Google Drive. It's progressive relaxation with hypnotic alpha binaural beats in the background that will help them to relax. But I prefer to do a personalized MP3, which is applicable to them.
Okay, Susan, I believe that you also have a Vidi therapy. Maybe you just develop that point for me. Explain it for us.
So yes, Aidan, I offer online or remote therapy for those people that, for reasons of geographical position, they can't come and see me in person in my office. And of course, yes, I offer online, or it's called viditherapy.com is my website. If anybody's interested in booking a session there, I do a phone therapy, and I have done that in the past. It's worked out really well. Sometimes people like to come and see me first in my office, and we get to know each other, and then they're very happy then to do the follow-up sessions then online. That's worked out really well. So that's what I can offer. Some people that, for instance, if they can't get a babysitter, they're waiting for their husband to come in from work or whatever, and it's great for that, I think.
Great. So how can we contact you, Susan?
So you can contact me on my website, carrigaline.hypnotherapy.com, viditherapy.com, susanmcgelligott.com. I'm on Instagram, viditherapy, and I'm on Facebook, Carrigaline Hypnotherapy, or my mobile,
Great.
086
Yeah.
877 6935.
Excellent. So that, once again, that was Susan McElligott in Cork. And thank you so much for today's podcast, Susan. I'm sure there's lots of benefit within the podcast today. And, I'm sure that anyone listening to it will be feeling much better and have a better understanding of hypnotherapy and hypnosis going forward. Thank you, Susan.
Thank you very much, Aidan. It's a pleasure.
And thank you for listening. I do hope that you have received some benefit from today's podcast. I have been your host, Aidan Noon. So please head over to eaph.ie and find solutions for you right there, right now. Until next time, bye for now.